The first step in assessing an emergency situation is check for breathing, ensure scene safety, call for help, start CPR. Ensure skin safety. The best position for someone in shock is typically sitting up, lying flat with legs elevated on their side, standing. प्लीज़ आप नए हो तो चैनल पे सब्सक्राइब कर लें. Lying flat with legs elevated, right answer. To control external bleeding, apply cold compress, direct pressure, heat medication. Direct pressure, right answer. The universal sign of choking is hand on stomach, coughing, hand around the neck, pointing to the throat. Right answer is hand around the neck. A burn that involves only the outer layer of skin is classified as first degree, second degree, third degree, full thickness. First degree, right answer. For a nosebleed, instruct the person to tilt their head back, lean forward and pinch the nose, lie down, apply cold compress to the back of the neck. B. Lean forward and pinch the nose, right answer. The compression to the breath ratio for adult CPR is 30:1, 15:2, 30:2, 20:2. 30:2, right answer. Symptoms of a heart attack include pain in chest, nausea, sweating, coughing and sneezing, headache and fever, blur vision. Right answer is A. Pain in chest, nausea, sweating. The first aid treatment for a sprain include rise, rest, ice compression, elevation, applying heat, exercising the joint, massaging the area. So rise, RICE. In case of poisoning, the first action should be to give the person water, make the person vomit, call emergency service, give milk. Right answer is C. Call emergency services. CPR should be performed when the person has a pulse but is not breathing, has no pulse and is not breathing, is unconscious but breathing, is having a seizure. So has no pulse and is not breathing. Then give CPR. An AED, automated external defibrillator, is used for broken bones, heart rhythm restoration, cardiac arrest, wound cleaning, fever reduction. Right answer is B. Heart rhythm restoration in cardiac arrest. जब cardiac arrest होता है तो हम डिफेब्री देते हैं. For chemical burn on the skin, the correct first aid is to apply ice, flush with water for at least 15 minutes, cover with a bandage, use antiseptic ointment. Right answer B. The FAST, fast acronym for stroke, stand for face, arm, speech, time, feet, ankle, speech, touch, finger, arm, speech, toe, face, ankle, speech, timing. A. Right answer. Face, arm, speech, time. When managing a fracture, immobilize the joint above the break only, below the break only, above and below the break only, using only a bandage. Right answer C. Above and below the break. Hypothermia occurs when the body temperature drops below 35 degrees centigrade, 37 degrees centigrade, 38 degrees centigrade, 36 degrees centigrade. 35 degrees centigrade, 95 degrees Fahrenheit. Right answer. For someone who has fainted, first help them sit up, elevate their feet, splash water on their face, give them a sugary drink. The Heimlich maneuver is used to treat fracture, perform CPR, clear airway obstruction in choking, immobilize sprain. Right answer C. Clear airway obstruction in choking. A common symptoms of shock is elevated blood pressure, cool, clammy skin, warm, dry skin, high fever. Right answer B. Cool, clammy skin. Apply. If bitten by a snake, the first action should be to apply a tourniquet, clean the wound and keep calm. Apply ice to the wound, cut and suck out the venom. Clean the wound and keep calm. Right answer. Hyperventilation is best managed by breathing into a paper bag, giving oxygen, lying the person down, encouraging slow deep breath. Right answer is D. Encouraging slow deep breath. For a bee sting, remove the stinger by squeezing it out, scraping it out with a flat edge, using tweezers, applying heat. Scraping it out that a flat edges bee sting होता है तो. In case of electrical burn, the first action is to apply water to the burn, check the breathing and pulse, apply a cold compress, cover the burn with ointment. Right answer B. Check for breathing and pulse. If in an open wound bleed heavily, the first step is to wash with the soap and water, apply direct pressure, remove debris, cover with a loose bandage. Right answer is B. Apply direct pressure. Sign of a severe allergic reaction include headache, difficulty breathing, mild rash, nausea. Right answer is B. Difficulty breathing. The recovery position for an unconscious but breathing person is on their back, on their side, sitting up, on their stomach. Right answer is B. On their side. An epinephrine auto-injector is used for pain relief, allergic reaction, fever control, blood pressure regulation. Allergic reaction. Right answer. The treatment for a muscles strain include stretching, immediate exercise, ice and rest, hot compress. Ice and rest. Right answer. If a person has a suspected spinal injury, first move them to a comfortable position, immobilize their neck and back, help them sit up, apply pressure to the spine. Right answer B. The main cause of heat stroke is dehydration, cold exposure, lack of oxygen, blood loss. Right answer A. Dehydration. A wound with a jagged edges is known as abrasion, laceration, incision या puncture. Laceration. A person having a seizure should be restrained, move the floor to the floor, given water, place in cold environment. B. Moved to the floor. A sunburn is typically classified as first degree burn, second degree burn, third degree burn, chemical burn. Sunburn is typically first degree burn. First degree burn को sunburn. The sign of dehydration include dry mouth, dark urine, sweating, excessive energy, low heart rate. Sign of dehydration: dry mouth and dark urine. A tourniquet should only be used in severe bleeding that cannot be controlled, minor cuts, head injury, mild burn. A. Severe bleeding cannot be controlled. The most effective way to prevent infection in a wound is to apply ointment, cover it immediately, clean with soap and water, apply pressure.